so you can share it with others and watch it at a later date as a refresher if you need to. I've gone ahead and muted all of the attendees except for our presenters. That's because we tend to get a lot of background noise and echo if folks are unmuted. So what you can do is just type questions into the chat box as we go, and then we'll also have a Q&A portion at the end, so you can ask questions then. The slides from this and other resources that we mentioned during the webinar will be sent out afterward, and we will also include links to all of the resources that we mentioned right in the slides. We didn't include them in these slides because you couldn't click on them right now anyway, but when we send the PDF of the slides out along with the other resources, you will have the links to all the items that we mentioned. Okay, just in case anyone is just joining us, this is Michaela, and I was just mentioning that the meeting will be recorded and that all of the attendees, with the exception of our presenters, are muted. So if you have questions, please go ahead and type them in the chat box, either throughout the webinar or toward the end, and we will answer them at the end during the Q&A portion. Okay. Moving on, the objectives for today are for all of you to be able to understand the consortium's advocacy objectives and how you can help achieve them, and also to learn about the consortium's advocacy tools and how to access them and learn about how they might be helpful to you. We also want you to become comfortable with the consortium's elevator pitches, both for home visiting generally and about the consortium. And then also to understand the basics of effective messaging for two different platforms, for social media and for news media. And then finally, we'll end with some suggestions for balancing advocacy on behalf of the consortium and your own organization. So when you're a consortium member, you sort of wear dual hats, and it could be difficult to balance advocacy for the consortium and your own organization, so we have a few tips for you there. Your presenters are myself, Michaela Ferrari, the consortium coordinator, Rena John, who is one of the advocacy work group's co-leads, and Christina Negrelli, who is the other advocacy work group co-lead. And just in case I forgot to mention at the beginning, the advocacy work group is the work group that is bringing this webinar to you. And then one other thing we wanted to remind you all of is that we did do a Home Visiting 101 webinar a few months ago, and that's on our website. So if any of this information related to home visiting in LA County is a little bit less familiar to you, you can also check out the Home Visiting 101 webinar and also share it with any friends or colleagues that are interested. Just a reminder about the consortium's mission. So why are we doing all of this work? Which is to coordinate, measure, and advocate for high-quality home-based support to strengthen all expectant and parenting families so that the children of Los Angeles are healthy, safe, and ready to learn. And with that, I'm going to pass it off to Rena John, who can start talking about the consortium's advocacy and how you can support our advocacy goals.
Right. So thanks, Michaela, and good afternoon, everyone. My name is Rena John, and in addition to being one of the co-chairs of the advocacy work group, I'm also a senior program officer at First 5 LA, and my main job is to support the agency's efforts relative to sustainability of our home visiting efforts. So as Michaela mentioned, I'm going to briefly go over the charge of the advocacy work group and talk about some of the work we're currently engaged in. So we want to start by stating what our goals are for the work group, which are listed here. And the first goal really speaks to the unique role the consortium plays in LA County as a coalition of key stakeholders dedicated to promoting and advocating for home visiting. So that's the work group's primary priority. And then the second goal really speaks to the consortium's efforts to focus on sustainability of home visiting in the county. So by engaging in strategies to leverage and maximize funding and to increase partnerships, for example, with county agencies. So next slide. So a lot of times when folks hear the word advocacy, they often think about public policy and legislative activity. So while this is a part of our work, advocacy means a lot more in the context of the consortium's work. It means public education about the benefits of home visiting. It also means promoting home visiting among various provider groups like healthcare providers and mental health providers, and how home visiting can be a support to them and like a referral source for their clients. And as we'll talk about later in the presentation, advocacy can also mean individual consortium members talking about home visiting one-on-one with your work colleagues, friends, and family members. So in the end, the goal of the work group is really about, really elevating the profile of home visiting broadly. So here on this slide are a number of tools the advocacy work group has created over the last few years to help consortium members in their efforts. Michaela just mentioned the webinar that was recorded a couple months ago. That one was really well attended and kind of gives you the basics of home visiting. And then secondly, we've got a couple one-pagers. We've talked a lot in our work group about how different audiences require different messaging and different audiences have different priorities. So we've developed a couple specific one-pagers that you can use with health audiences, and another one-pager that you can use specifically with policymakers. We've also got a one-pager on the positive benefits and outcomes of home visiting. And then finally, we really wanted to, we think this last piece is one that really a lot of you have a lot of great information on in terms of success stories, client success stories. Those can be some of the most powerful tools that we share in our advocacy work. So next slide. And so this slide has a few examples of the different tools we've developed over the last year or so. So a lot of work group discussion, consideration, and deliberation has really gone into each of these. They've been vetted by our work group members. So we really feel like that they'll be very useful to you and useful to the consortium broadly in our collective advocacy work. And they're there for everyone to use. So, next slide. So our advocacy work group does engage in monitoring, tracking, and when appropriate, supporting policy issues that impact home visiting. So since the consortium is so unique in that it's a coalition of many agencies with many different positions and perspectives on issues, we always expect a lot of discussion when it comes to deciding on what policies we'll be supporting in a given year. So the work group has put a lot of time and energy into identifying how we prioritize policies and in the most appropriate and fair way that builds consensus among our members. So last year, the consortium adopted a set of what we call the advocacy guidelines. And without getting into the specifics of the guidelines, I think it's sufficient to say that in like this, we're bombarded with, state, federal, and local policies, probably on a daily basis. But what the advocacy guidelines do is really provide the consortium with a process by which to prioritize the policies that we support. So it's sort of it breaks it down for us in terms of a process. And finally, we also wanted to mention the work group is currently working on developing a policy and advocacy platform. So as a supporting document to the advocacy guidelines, the platform is kind of the lens by which we look at and evaluate legislation and policy issues against the consortium's goals and objectives. So in some ways, like the platform will be the first step. the advocacy guidelines are sort of the next step in that process of identifying our platform for the year. So next slide. And this slide has some key examples of our policy work to date and some clear actions the consortium has supported in the past. I'm guessing most of you know that this last year and a half has been kind of a roller coaster relative to the outcome of MCV reauthorization. MCV stands for Maternal Infant Early Childhood Home Visiting, and it is the only federal allocation of funding specifically for home visiting in the nation. So MCV is an example of a policy the advocacy work group and consortium broadly has been tracking and supporting. And one specific way in which the consortium, along with support from First 5 LA and a group of county partners, supported MCV reauthorization efforts in 2017 was by moving forward a letter of support for MCV signed by the LA County Board of Supervisors. And that letter went to various state and federal representatives on behalf of the county. So, and then consortium members participate in many other activities like those listed on the slide, you know, days of action, they write letters, they make phone calls, visit your reps or other stakeholders. Next slide. Yes, and then coming soon, and we'll be having, we'll be looking at moving forward a couple bills for the general consortium support. So, so finally, we wanted to give you some real-time updates on policies we're tracking right now. Each year, we look to support important priorities and watch a number of other priorities. So this year on the state level, the advocacy work group has been tracking AB 992. That's the CalWORKS Baby Wellness and Family Support Home Visiting Program. You may be familiar with CalWORKS funding. It is federal funding which flows through the state for social services. It's also referred to as Temporary Assistance for Needy Families funding, or sometimes called TANF. So this bill would allow counties to use their social service dollars to support home visiting efforts. Additionally, in the governor's budget, there's $158 million in CalWORKS funding being reserved for this program through calendar year 2021. So it's just some context is that in 26 states across the nation, social service dollars are used to support home visiting efforts. But this is just not the case in California or LA County right now. So overall, this is just a really historic moment for home visiting in the state. One, that it's been named in state legislation for the first time, but also that there's a budget proposal attached to it. And then the second bill we're proposing to support is AB 11, which is Early and Periodic Screening, Diagnosis, and Treatment Program, which seeks to improve developmental screening for children through the use of a validated tool. So we know home visiting has a really positive impact on developmental monitoring of children. Home visitors conduct screenings, they equip parents with the tools and knowledge to monitor their developmental milestones in their children, and they encourage the parents to talk to their pediatricians about their child's developmental needs. So we see both of these bills, 992 and 11, as ones that we want to propose to move forward to the general consortium and recommend the consortium support. And then per our advocacy guidelines, we'll be bringing these to the April quarterly meeting. And then I'm not going to go into the watch list, but it's just what we wanted you to also know there's a number of bills we're sort of watching and tracking. So next slide. And then finally, you know, as a member of the consortium, we just really want to encourage all of you as ambassadors of the consortium's work wherever you go. You can do this by bringing your colleagues to meetings, getting involved in the work groups, and sharing all of the different consortium resources. So some of the most useful information we've listed on this slide, but the website that Michaela has put together has a ton of information you can pull from, and so it's very comprehensive. And with that, I'm going to hand it over to Christina to discuss home visiting messaging. Thank you.
Are you there, Christina?
Oh, can you hear me?
Yes, we can hear you.
Okay, sorry. I was talking on
That's
mute.
okay.
Thank you. Thank you so much, Rena. I'm Christina Negrelli, Senior Director of Programs for 0 to 3, and one of the other co-leads of the Advocacy Work Group for the Home Visiting Consortium. So my job today is to share with you a little bit about communications, particularly about communicating to external stakeholders about home visiting and the consortium. So essentially being a voice for home visiting, a champion or an ambassador, as Rena just shared with us. So how can we talk with others about home visiting and the consortium? With an elevator pitch. The Advocacy Work Group developed an elevator pitch for members of the consortium to speak with a uniform or a collective voice about home visiting. Developing this elevator pitch supports our goal 1, which is around educating others about home visiting, helping families. So let's give it a try. Did you know that home visiting helps achieve positive outcomes for children and families, prevents families from entering crisis systems, and effectively prioritizes and connects families to correct support systems? So continuing with this elevator pitch and this development, really focusing on speaking with a collective voice, and we have a goal talking about the consortium, our work, and encouraging other organizations on how to get involved. So how do we do that again? By speaking with a collective voice. So try, for example, introducing yourself. Hi, I'm a member of the LA County Home Visiting Consortium. The consortium is a network of organizations working to advocate for high-quality home visiting for parents and families. Our goal is that children of LA County are healthy, safe, and ready for success in school and in life. So as you can see, this message speaks to the who, what, and why of home visiting. So what makes a message work? The Advocacy Work Group members participated in a crash course, if you will, on communications, not only hosted by First 5 LA, but actually delivered to us by the First 5 LA's communication team. We learned a lot. And at 0 to 3, key staff who typically speak on behalf of the organization have undergone this type of training as well. And it's really important to pay close attention to simple rules or guidelines to stay on point and deliver your message. So these keys to an effective message include 3 simple things. Number 1, limit to 2 or 3 points only. Speak in plain language and keep it simple. Next slide. So there are 3 main messages about the consortium that have really helped to inform the elevator pitch. So these key messages, remember, keeping it simple, 2 or 3 points. Number 1, focus on coordinating, monitoring, and advocating for quality home visiting programs in LA County. Second, the goal is for children to be healthy, safe, and ready for success in school and life. And 3, the consortium is a volunteer network of organizations, including each of the home visiting models operating in LA County, county agencies, nonprofit and advocacy organizations, foundations, and funders. Three simple messages. Next slide. So again, let's try it out, this elevator pitch for the consortium. And you can see how we've put the 3 key messages we just reviewed into one simple message. Hi, I'm a member of the LA County Home Visiting Consortium. It's a network of organizations working to advocate for high quality home visiting for parents and families. Our goal is that children of LA County are healthy, safe, and ready for success in school and in life. Next slide. So those were the three main messages about home visiting that help to inform the elevator pitch. You can see one helps us achieve desired outcomes, prevents families from entering crisis systems, effectively triages clients to correct supports. Home visiting equals effective triage. Home visiting programs screen for depression, they screen for developmental delays, educate parents on developmental milestones, connect families to primary care instead of emergency rooms, and connects families with concrete resources such as childcare, public assistance, regional centers, and more. Next. So again, let's try it one more time. Our elevator pitch is, did you know that home visiting helps achieve positive outcomes for children and families, prevents families from entering crisis systems, and effectively prioritizes and connects families to correct support and systems? One message with 3 key points. That's really essential and will help you to keep on message when you're communicating on behalf of the consortium. Next slide. Again, consistency, consistency, consistency. It's essential for effective messaging. And remember, you are one part of a chorus, not a solo singer. So if we're all communicating alone or in isolation, we never really share the full picture of what we're trying to communicate. And folks are left guessing. Is it a wall? Is it a tree? Is it a snake? Nope, it's a rope. So this consistency, staying on message, and remembering that we are part of a chorus, not a solo singer. 3 key points, very essential. Next slide. So messaging and advocacy for the news media. Here's a few things to consider. And remember, staying on point, simple, and important. So try to have questions in advance of the interview or speaking engagement, and prepare. So if speaking organization, #1 rule, always contact your communications department first and confirm that you are able to speak on behalf of your organization. Try to know the reporter and the source. Read articles by the reporter and research publications. You get to develop a sense of their tone, their message, potential questions they may ask, and know the story. Ask questions in advance of the interview or the speaking engagement. Try to discover what the focus is. What will the format be? Is it question and answer? Will you be given a certain amount of time to speak, offer your key messages, and then ask questions? And who else is being interviewed? Where are they from? Do your research in advance, most important. And if asked about the consortium, try to remember to stick to the consortium's elevator pitch. You can explain why your organization is a member and why participation in the network is so important to you and your organization. Try to refer further inquiries to the coordinator of the consortium for more information. Remembering that you are not alone and it's a collective voice. So during the interview, remember to speak slowly, clearly, and in a conversational manner. When you've made your point, stop talking. If the interviewer asks an off-topic question, try to pivot back to your talking points. That I personally find very challenging. My first reaction to answer the question. And what I learned through the training I experienced at our organization, as well as what the first 5 LA communications team taught us, is always go back to your talking points. It's called a pivot, redirect. So remember those 3 key messages and go right back to them. So for example, if they ask We're talking about home visiting, the importance. You've given your elevator pitch, and all of a sudden, the interviewer asks you for your position on a particular bill. You might pivot back by saying, home visiting, and then lead right into the elevator pitch. Remain on your guard and always remember to thank the interviewer. I think it's just, you can never be too prepared. And I think you're never going to know all of the questions, but remember, stay on point. Remember the elevator pitch and how to pivot right back to your talking points. Thank you. I'm going to turn it back over to Michaela, who's going to continue talking about messaging.
Thank you, Christina. So we're going to switch a little bit now and transition into talking about some basic messaging and advocacy tips specifically for social media. And I just want to again thank the First 5 LA communications team for contributing so much of the content for this presentation. So before we get into this page, I want to clarify that the consortium doesn't have a Facebook or Twitter account itself, but these are suggestions for how you can use these tools with either your own organizations or your personal Facebook or Twitter or other social media accounts for advocacy purposes. So Facebook and Twitter are just two of the many social media platforms that can be used for advocacy purposes. And personally, I'm too old to tell you about anything else. So I'm just going to focus on Facebook and Twitter. Facebook, because it doesn't have a text limit, is often seen as more of a storytelling tool. But because the turnover in what people see when they log on to Facebook is less frequent, the suggestion for advocacy purposes is to post less frequently on Facebook. On the other hand, Twitter has much more rapid turnover, but the text is limited, so you can post on Twitter more frequently. For both Facebook and Twitter, images and videos are great ways to add interest. You can also tag people and organizations in both Facebook and Twitter. And you can also use hashtags, which we'll talk more about on the next slide. So as I mentioned, these are just some of the many social media tools that you can use for advocacy. And these are the points that they're particularly useful for. So moving on to talking about hashtags. So I mentioned earlier that you can tag someone, but that's different from using a hashtag. So hashtags allow you to share ideas, slogans, keywords, or campaign titles. So you can put a hashtag in front of any word or series of words that you want, and it will be aggregated with any other posts using the same hashtag. This is a great way to link your tweet to any specific ideas or campaigns. So say, for example, you want to tweet about the importance of home visiting. If this were during the period of time when we're working on MCV reauthorization, you could use a hashtag related to MCV in your tweet, and then your tweet would come up linked with all of the other tweets that use that same MCV hashtag. Some of the sort of best practices for using hashtags are that you keep them short and simple. So again, similar to what Christina was saying, keep it simple. And also that you research existing hashtags before creating a new one. You want to make sure that if there's already a hashtag for your issue or campaign, that you're able to use that one, again, consistent messaging. And you want to make sure that the hashtag that you're thinking of using isn't already in use for a different issue. So some suggested hashtags for home visiting are hashtag home visiting, hashtag home visiting works, hashtag MCV, hashtag ECE, or hashtag B through 5. And the cartoon on the right is an example of how you should not create hashtags, neither short nor simple. Okay, here's an example of both tagging, which I mentioned earlier, and using hashtags. So to tag something, you need to make sure that the organization or person has an account on the platform you're using. So to tag an organization on Twitter, that organization also needs to have a Twitter account. This case, More for McV, is a hashtag. So this tweet would be aggregated to all of the other tweets that use the More for McV hashtag. You can see in this one, Parents as Teachers has tagged an organization and used hashtags. This is also an example of tagging organizations and using a hashtag. In this case, they've created an acronym for the McV All Grantee Meeting, which is shortened to AGM, again, for purposes of keeping it short and simple. So here's another example of tagging people and organizations in a tweet. In this case, the Nurse Family Partnership National Service Office is tagging the Parents as Teachers, Healthy Families America, and Hippie Twitter accounts in their post. Again, tagging other people helps give more information about the people, organizations, and places involved, and builds relationships with others. Excuse me. So here are some examples of consortium members and other home visiting programs. As I mentioned earlier, the consortium does not have a presence on Twitter or Facebook, but many of our members do. So if you're ever at a conference related to home visiting and you want to tag other consortium members in the room, here are some examples of who you might be able to tag. Okay, and one last example of all of the different things we've just talked about, bringing it all together. So we have hashtags that draw attention to a shared message or campaign, in this case, fatherhood and Project Fatherhood. We have photos for visual interest. We have tags of other organizations' Twitter accounts, and geotagging, which we didn't discuss here, but essentially allows you to tag the specific location where the tweet was made. So in summary, here are some ways of balancing advocacy for your own organization and for the consortium. And again, advocacy can include social media, news media, and just plain old-fashioned conversations. So the first tip is to proactively work with your organization's communications team to ensure that your messaging is consistent with what they've established as their policy platform. This is something that Christina also mentioned that you do before any news media. Secondly, you want to understand the advocacy parameters of your organization. And finally, knowing your organization's and the consortium's positions on specific policy issues is really important. If there are any inconsistencies between the consortium's position and your organization's, you want to prepare comments in advance so that you can address those inconsistencies. And again, if you have any requests for in-depth information on the consortium, refer those requests to the consortium coordinator. So in summary, advocacy takes multiple platforms. It's not just sitting in a legislator's office. It can be as simple as sharing information about home visiting or about the consortium in conversations with friends and colleagues. It can be using social media to spread information or messages about home visiting, early childhood issues, or pregnancy and parenting. And it can be sharing home visiting success stories with others. Sticking to the elevator pitches will help us be more effective together because people will hear consistent and recognizable messages. So just think about that cartoon with the elephant. If we're all saying different things, then no one will understand what we're saying. And finally, think locally to maximize your network's impact. So as I said, advocacy is more than just legislative visits, and especially as a member of the consortium, our work is very local. A lot of the advocacy that we do involves advocating for local system changes with our colleagues and partner organizations. As we noted, social media can be a great tool to reach a large audience and show strength in numbers, particularly if you're tagging other organizations and using common hashtags that represent a large campaign. And finally, you and everyone else in the consortium can be an advocate and act as a signal booster for our message. Together, our power is much greater than if we're all individual voices. So with that, we will hand it over to you for any questions. So again, everyone is muted because of potential background noise, but feel free to type any questions in the chat box. No questions? Okay. Well, in case this wasn't enough for you, we are planning Home Visiting Advocacy 102, and that will be probably in another few months, and that's intended to be a follow-up to the Advocacy 101 and be for a broader audience. And that webinar will allow us to put some of the advocacy tips and tools that we mentioned today to practice. Mihai asked, how often do we do these webinars? So all of the 4 work groups in the consortium do webinars on a semi-regular basis. Some of them are related to other resources in the county. This one is specifically for the consortium, but we tend to have a webinar at least every 2 months at this point. And yes, to answer your question, the slides will be available. So we're going to be sending out the slides as well as all of the resources that we mentioned in this webinar. So our one-pagers, the link to the Home Visiting 101 webinar, our advocacy guidelines, etc. We will also include in the slides the links so that if you want to access it online, you can do that as well. And this has also been recorded, so this webinar will be put on our website as well. Okay, if there are no other questions, we want to make sure to thank all of the contributors. As I mentioned, the advocacy work group is the group that put this together and brought it to you. Rena and Christina are our advocacy work group co-leads. LA Best Babies Network, the Partnership for Early Childhood Investment, First 5 LA, and particularly their communications team, and Big Orange Spot Consulting. A special thank you to Rena and Christina for all of their help and wonderful hosting.
And a special thank you to Michaela for all that you do, including preparing the webinar.
Thank you. Okay, thank you, everyone. We will send out all of these materials and the recording as soon as they're available.